And welcome back. Excitingly, it is now time for our Nurses Technology Innovation Competition. So in case you didn't know, to recap, the Nursing Times Nurses Technology Innovation Competition is for nurses who have had an idea for a technological innovation that could improve patient safety and experience, simplify processes, or free up nurses' time. We've basically got two categories this year. The first category is Digital Practice of the Future. So this category is for individuals or small teams with new ideas that use established or emerging technology that could change nursing practice in the future. So basically, you can present your concept or idea and explain how you see it developing, including what help you needed to make it happen. Whereas category 2 was about digital practice that is a proven concept. So basically, this category is for individuals or teams who have developed a small-scale digital project, pilot, or minimum viable product that is able to take the next steps in its development to becoming a large-scale or better evidenced project. So in a minute, you're going to hear pitches from our finalists for both categories. So there's 3 finalists in each category, so 6 in total, as they try and basically sell their idea to our judges. So we're going to start first with category 1, and then we'll have a break and then go on to category 2. Importantly, you will be able to vote as the audience for your favorite entrance. So voting will be open from 11:45 to 12:30. So just to recap, that's 11:45 to 12:30. And the winner will be announced at the end of the forum. And we're going to put up a QR code during the break, so you can use that to vote as well. I'll remind you of that when we get there. And also, the voting works. A quick reminder that we've adopted a system which I've been told is similar to Eurovision, where the votes are weighted 75% towards the judges and 25% towards you, the audience. So there we go. That's how we'll get the winner. So I'd just like to introduce our esteemed judging panel. So we've got Professor Natasha Phillips, founder of Future Nurse, and a former national CNIO. We've got Helen Borsden, who's interim chief nursing officer for NHS England, who you heard from yesterday. And we've got Professor Gemma Stacey, who we also heard from yesterday, if you were listening, who is deputy chief executive of the Florence Nightingale Foundation. So I'm just going to give a quick précis of our shortlist before we get on with it. So this is category 1, as I said, so it's digital practice of the future, and we've got three finalists. We've got Dr. Roxanne Crosby-Nwabi from Moorfields Eye Hospital, NHS FT. Then we're going to have Nav Bari, from Derby Community Healthcare Services, NHFT, and then Mohammed Shamir Amuruddin, who is from Doncaster and Bassett Law Teaching NHS Trust. So I'm going to hand over now. We're going to watch a short video from Dr. Roxanne Crosby-Nwabi before we go into the Q&A.
Hi, I'm Dr. Roxanne Crosby-Nwabi, lead nurse research at Moorfields Eye Hospital. I'm pleased to present our idea for a hospital-driven smartphone application to revolutionize medication adherence in our patient population. In a recent UK survey, 86% of people said that they value their sight above any other sense. Similar sentiments were seen in a US study in which patients were asked which of the following conditions was the worst thing that can happen to them, between blindness, cancer, HIV/AIDS, and Alzheimer's. Most people said blindness as they feared the loss of their independence. Complex medication regimes, including polypharmacy, can be overwhelming for our patients, particularly those with cognitive impairment, frailty, poor eyesight, or limited dexterity. The problem is amplified when they return home from hospital, isolated from the immediate guidance of healthcare professionals. The difficulty experienced by patients in interpreting dosing instructions is often underestimated by healthcare professionals. This inadvertently leads to variability in the administration of prescribed medication, exacerbation of health issues, increased health costs, and preventable hospital readmissions. So let's listen to our patient.
Hello, I want to explain my experience with a very complicated medication scheme. In 2019, I contracted an infection in my right eye. It was a fungal infection, so very serious. And this led to, as the condition of my eye worsened, I had a lot of drops and some pills to take as well. So the medication regime got very complicated, and at one point it was over 24 hours, once an hour. I had to decide on which of about 10 different medications I had to take. So from the start, I decided I needed some digital help with this. So set up, it was a spreadsheet, an Excel spreadsheet. I can show you an example of it so you can see the kind of thing that I did. You should be able to see it on there now. You can see that it's 24 hours down one side and the 10 drops along the top, and the number of different ones each day, for each hour, which ones I had to take, and making sure that they all added up to the right amount, and so on. So this was quite complex, which was fine for me because my job at UCL is I'm professor of learning with digital technology. So this comes naturally, but all the time I was thinking about, I've had no help with how to do this. I'm sure there must be lots of people who find this really difficult. And for me, the difficult part was that it was, I mean, it's a painful condition. So you're in pain and you're having to stare at a screen, which is the very last thing you want to do if you've got a painful eye, to do this very detailed process of working out how best to manage this medication scheme, along with having to set up all the alarms on my mobile phone for every hour, and then some of them had to be twice, so you had to do the snooze, so you get the 5-minute call to do another one, which was very complicated, difficult to do, and of course I had no help at all. So pretty soon after it all got better, I was thinking, I talked to pharmacy about this at Moorfields actually. I said, we've really got to give people help with this. And several times I mentioned this to people and everybody said yes, it was a good idea. And finally, I noticed this research call, I think it was, from Moorfields. I got some newsletter about it and suggested that we try to turn this into a digital app for people, because there must be lots of different kinds of conditions, not just eye conditions, but many kinds of complex medical conditions. And some people with complex eye conditions will have other things wrong with them as well. So they have very complex medication schemes. And when you're in pain and you're anxious and things are going badly for you, the last thing you want to be doing is having to set up this complex kind of digital world for yourself. So I think there's a lot we could do to make this better.
Thank you, Diana. And as Diana said, there is no existing solution that delivers reminders and support to our patients seamlessly. Ably supported by my team, we embarked on this journey of discovery, always keeping the patient at the centre. We interviewed 6 patients, age range 14 to 75 years, who were prescribed complex drug regimes. All of our patients reported feeling tired, wrung out, and disoriented due to the hourly waking times. While most patients use their smartphone devices to set their alarms, they all expressed extreme difficulty in doing so due to eye pain, blurriness, and general malaise. Others relied on their partner to remind them, or just gave up after 4 hours, which is the last thing you want to do if sight is your most important sense. Our patients said that they were unsure as to whether they were doing their drops correctly and what were the implications for their treatment regimes if they missed a drop. Our patients developed various innovative methods to log their medication adherence, but they couldn't do the same with their drops. All patients wanted an app if it was available and gave us several ideas for development and implementation, such as a frequently asked questions section. We also spoke to staff. We sent an anonymous survey online to all ophthalmology units in London, and 82 staff responded. 61% of those staff said that they spent 1 to 3 minutes educating patients, and almost all of them stated that they would recommend a hospital-approved app if it were available. So patients happy, staff happy, we're on to a winner. Nurses and clinical staff need to embrace and promote technological solutions to enhance patient care and empower self-management of conditions in tandem with the healthcare provider. So, the MedMemo smartphone app, what is it? Our app serves as an automated hospital-driven medication reminder system with a core focus on interoperability and integration. Tech savvy, we got you. There's a direct integration with the hospital's electronic patient record system or prescribing system. Not so hot with tech, we also got you. There's a manual entry via a web-based backend, and there'll also be a QR code for standard drug regimes. So what are the benefits and features of this system? Number one, it's adaptable to different settings and different solutions. There are tailored reminders to each patient's unique medication schedule, thereby minimizing the risk of errors. Education integration. An educated patient is an empowered patient. And with all these features, there is improved clinical efficiency, thereby releasing time to care. In terms of accessibility, our patients can view their prescription information in their preferred language, thereby reducing medication errors, improving medication adherence, improving treatment outcomes, and reducing health inequalities. There are also other features such as voice recognition, and we will also have a loaner phone system for patients who are digitally excluded. We have also included an Ask the Prescriber function, which will enable bidirectional asynchronous messaging between the patient and their provider, such that health concerns and questions can be rapidly responded to, supporting adherence and avoiding any unnecessary readmissions to hospital. The integration of technology into nursing is not just about innovation. It's about enhancing patient care, ensuring better outcomes, and improving the efficiency of our healthcare teams. Our MedMemo app is deeply rooted in the real challenges faced by patients and nurses alike, and promises a future where medication adherence is not a hurdle, but a norm. With the right support and collaboration, we can transform this vision into a tangible solution which is focused on advancing the health of our population using digital technologies. Therefore, vote MedMemo app. Reduce health inequalities, narrow the gap. We thank you.
Great. So we now have our live Q&A section, which is basically where our judges will ask for more information to help them come to a decision on their winner. So I'm delighted to say that Roxanne is joining us from Moorfields to talk to our judging panel. And I'd like to now hand over to the judges. So they will have around 5 minutes to talk to Roxanne.
Roxanne, my question's about, you're very focused on ophthalmology and clearly the eyes, but where else do you see this working, this particular app, in what other specialties?
Yeah, thanks, Helen. As Diana said, this is available and is applicable to all specialities, especially as we have an older population and lots of comorbidities. We've just recently added one feature onto the app looking at polypharmacy, where we'll be able to alert the providers of any other medication that may have risk factors or adverse events against other medications. So say, for example, in ophthalmology, we give them a particular drop that would have a systemic effect on if they're going to rheumatology or if they're going to have diabetes medication or whatever, it'll be able to alert the provider. So this app, even though it came from a patient in ophthalmology, it's applicable across the system, because an educated patient is an empowered patient, and therefore we should help patients to be able to self-manage their conditions.
Thank you. I'll pass you to Natasha.
Thanks, Helen. Roxanne, thank you. That was fantastic. I really loved the sort of patient-driven element to identifying the problem, and then how much you involved everyone in terms of researching the problem really well before you jump to the technological solution. I'm curious now about, it's related to Helen's question. So scalability, how widely have you tested this now? How much adoption have you got? And what are your plans for getting it widely adopted?
Yeah, thanks, Natasha. So this is a very, I wouldn't say embryonic idea. We've been working on it for over a year. And that's why we brought it to this platform, to get the help and support that this group will be able to give us. But our CCIO and our chief nurse is completely behind it. We've spoken to a few tech startup companies to see what ideas they do have. Our CCIO and myself has talked about building this iteratively. So therefore, we have a loaner phone system within the hospital already. We'll be able to loan our patients a device if they don't have one, put our reminders in manually first, and then iteratively build a process along with our patients. So even though it's quite new to this, we do have a system set up, but we would love to have the support of the NT digital team and the NHS digital team as a whole.
I think the National Medications team would be really interested to hear more from you.
Yeah,
I agree indeed.
Thank you so much, Roxanne. I've got two questions, if that's okay. So my first question is around understanding some of the inevitable barriers and hurdles you must have had to navigate to get to this position. And then my second question is around how will you know that it is having the kind of impact and outcomes that you hope it is having or that you predict it will?
Yeah. So first, the barriers. There aren't any. I just consider the first no as a maybe, and we progress on from there. As long as our patient said it needs to be done, that's where I'm going. That's my ethos. So that's the first one. What's the second question again, Gemma?
How will you know that it's had the impact that you're predicting?
So within the app, we've got a feedback system which allows the healthcare professional to monitor the patient's adherence regime while they're taking their medication. So we can intervene as an early point if we see that the medication log isn't happening. So that's one feature. Also with our patients' treatment outcomes. So I mentioned there was a patient who gave up after 4 hours. We were able to see that she wasn't taking her medication and obviously intervene when she came back to us. So we're looking at those outcomes, patient-related outcomes, as our impact factors, and also adoptability of the app, how many patients choose to have the app on their phone, not only at Moorfields, but across the patch nationally as well. So those are the kind of things we're looking for as outcomes.
And as a researcher, Roxanne, what do you see the potential for this in feeding into a different way that we can use this type of data and technology to inform our work going forwards?
Yeah, from a research platform, this platform will have numerous possibilities. I mean, as a researcher, we always know we give patient medication, we're not sure of the adherence, we're not sure of the outcomes. I think it will allow us, rather than using patient diaries, as we tend to do now in research, or even something a bit more sophisticated, but still crude, especially in ophthalmology, we use either a pill counter or a drop medication regime where you squeeze the bottle and then it says you've taken your medication. This would give patients a lot more control over their health, over their care, because again, it's not just about taking medication, but it's about learning about your condition, whether it's your eye condition. It's also in your own language. You're also able to take that medication home to your family, the disease condition linking into the NHS Digital and the NHS platforms for different conditions, eye conditions, general conditions. So it's not just about you, it's about your family, about your community, all learning. And I think this app is just one part of the cog, but it can be the patient's diary, dictionary, encyclopedia to opening a medical world for them and their families and their communities.
Great, thank you, Roxanne. I have to step in there. I think we've run out of our 5 minutes, so thank you very much. So next up, we've got a Nav Bari's video presentation, and so this is from Derby Community Healthcare.
Welcome. My name is Nav Bara and I'm a 5 to 19 specialist community public health nurse practitioner, or also known as a school nurse. I'm currently working for Derbyshire Community Health Services, and thank you for shortlisting me for my application. I would love to share my vision of the All About Me smartphone application with you. In today's presentation, I aim to provide you with some statistics to support and evidence my initial thoughts around the development of the All About Me smartphone application, or AAM for short, reflect current health inequalities affecting our 11 to 19-year-olds and how these can be benefited through a public health upstream approach. I aim to share visions of a service user's journey in using AAM and how this would improve their experience and safety, and how this aims to be analysed, reviewed and transferred to be used in the wider school nursing arena. Firstly, I would like to share some statistics so I can support your understanding of the view of our voice of our young people across the country. In England, there are approximately 11.1 million families with children. To support those families with children or young people aged between 5 and 19, there are approximately 852 qualified school nurses. There are nearly 9.1 million children and young people that school nursing staff members need to support in school, and in school nursing staffing this is approximately 1.5 school nurses for every 10 schools. We also need to remember those children and young people who are electively home educated, looked after or not in education, employment or training. Considering the current school nursing staff and the number of children and young people that should be in receipt of equitable public health offers proposes many challenges. Building on the voice of our young people, we know that there are public health inequalities that young people require support for, especially since the COVID-19 pandemic. Firstly, thinking about neurodiversity. It could be the case that a young person's friend has ADHD but does not quite understand why their friend is struggling so much on their conversation due to their fidgeting and lack of focus. Out of curiosity, that friend may Google support but comes across All About Me and finds evidence-based information and signposting resources to educate themselves and support their friend. Secondly, let's think about vaping. It's widely recognised as an epidemic amongst our young people. It could be the case that a young person has sought support from their school nursing team and they have recommended to download AAM in conjunction with one-to-one support. The young person identifies that vaping is actually making their anxiety worse and they begin to stop. They share this great outcome with a friend and they also download AAM out of curiosity. Lastly, it could be the case that a parent or carer has taken their young person to the GP to ascertain support for their panic attacks. A GP may refer to specialist mental health services like CAMHS, which has an ever-increasing waiting list. At the health practice, a poster for AAM is seen and the young person downloads this and finds an evidence-based resource that explains the feeling of panic and how to manage this. The waiting list for CAMHS is 18 months, but the young person, through individual empowerment and education, has decided that they don't need the specialist support. This may therefore promote individual empowerment, reduce waiting lists through effective preventative education, and in the long term relieve service pressures. Evidence base behind the digital offer. Firstly, NICE has recognised and recommended digital innovation specifically to target the mental health of young people, including behavioural based innovations such as puzzles and games based upon CBT principles, again pioneering the digital footprint of accessible digital information to young people. Secondly, research conducted by SAFNA, the School and Public Health Nurses Association, piloted the use of a healthy eating app. This demonstrated that there were effective outcomes by using the app and supporting the young person to take more ownership and responsibility of their health choices through the food that they were eating. The app again was underpinned by behaviour change and demonstrated effective outcomes as a result of the information being presented in a young person friendly manner. Furthermore, another study conducted by Oxford Brookes University in focus groups with school nurses demonstrated that virtual modes should be integrated into school nursing practice, especially following the COVID-19 pandemic, to enhance the current flexibility demonstrated in school nursing practice. The Nursing in COVID Times report 2022 further recommended that the school nursing offer requires standardisation, which could be achieved through health education means on AAM. Lastly, research conducted by Goodyear in 2018 identified that there are over 160,000 health apps, and these are reported to be of particular interest to young people, even though most are designed for adults due to the influence of social media and flouting of age restrictions on these platforms. And lastly, the Royal College of Nursing advocates for every nurse to become an e-nurse, to effectively innovate and support data to continue to move with the current times of technology and ensure the patient's best outcomes. Suggestions such as a texting service for young people has previously been successful in the context of Chat Health, and for me this is just the beginning and not a stagnant yet effective resource. Collaboration in service innovation is key. I would like to take this opportunity to expand further of the importance of information coming from an evidence-based, consistent, reliable source such as the NHS.UK website. There are many partner agencies that can now be seen on this slide, and this demonstrates to me an opportunity to effectively collaborate and ensure that all services are essentially singing from the same hymn sheet. AAM would have the scope to link to local signposting, allowing social inclusion, allowing young people to take control and understand the implications of them making their own health choices sourced from information from a reliable and consistent evidence base. with improved health education at their fingertips and at an early stage could unlock additional capacity and improvement of school nurse workforce and staff wellbeing as a result of adopting a preventative and not a reactive service. This slide shares a poster design for AAM that was collaboratively designed with students in secondary school and a few electively home educated families. This initial development again demonstrates the importance of collaboration with service users to promote listening and working together. I would aim that the app development would also echo this ethos. Furthermore, from Derbyshire-wide anecdotal information, young people would absolutely love short and snappy TikTok or Instagram reel-like videos based upon public health topics, as they would find this information more relatable and easy to absorb the desired information from the public health team. I believe that this application has the scope to be piloted for proof of concept to ensure that feedback can be received for effective change and ease of application usability and access. Data collection and analysis and improvement of the application could be monitored by concepts including the number of downloads, number of hits on the app, and questionnaires pre and post use of the app. There are some areas that require support and development. For example, a worry that a lot of our young people have is an application taking up too much storage on their phone. And in regards to time frame of data collection, again, I feel that this would aim to be decided collaboratively with the development team to ensure that the app is developed and rolled out in a robust and systematic manner. This would then therefore lead to effective transferability and the wider comparability of the effect of health inequalities on specialist services referrals, for example, the impact upon CAMHS. Into my vision, All About Me, or AAM, is a concept now that will allow our young people to grow their independence and ultimately become the architects of their own physical and emotional well-being. At present, the application is a concept and requires specialist support to progress this further. I thrive to improve the health and well-being of our younger population to make their care equitable, reliable and consistent. So let's prove the concept of All About Me and make it all about them, as they are our future. Thank you.
And again, Nav is joining us now for the Q&A, so over to the judges.
Shall I start this time?
Yes, please, Gemma.
That was excellent, Nav. Really, really enjoyed that. I can really hear your passion for the innovation and the potential is huge, I'm sure. I wondered if you considered the parent's role within this or the caregiver family member, and whether there's any functionality that might support them with their concerns and worries.
Thank you for your question, Gemma. Absolutely. So at the moment, as a trust, we're actually currently thinking about working and running parental online forums to support our age ranges between 5 and 11 years old. So we're making sure that we're continuing that digital offer throughout the whole of the 5 to 19 service. But for those aged 11 to 19 for which AAM is targeted at, we're wanting them to really take that ownership. And if there are parental concerns or if there's safeguarding concerns that relate to us within our role, then we can escalate that appropriately, but also making sure that kind of we're promoting our service just as much as we are AAM to parents so they can access us as well if they've got them concerns there.
Well, thank you. I'll hand you over to Natasha.
Thanks, Gemma. So a couple of questions for me, Nav. Thank you. Brilliant presentation. I'm really curious about the market research that you did in order to get to the decision that the app was required, and where that app sits in the sort of ecosystem of behavioural apps available currently. And then secondly, you talked about needing support to get to pilot and proof of concept, and it'd be really good to understand a bit more about what support you need, what you've planned about, who you want to work with in order to move to the next stage.
Thank you for your questions. So in terms of kind of where AAM came from, I've recently qualified as a specialist community public health nurse as of literally September. So I've been in the role for a month. So it was part of an innovation project that I did as part of one of the university modules. So it was birthed from there in terms of looking at a health needs assessment within the local community, what was missing, capturing the voice of young people from varying youth forums, electively home educated, obviously, which is one of the vulnerable groups that we're trying to really promote an equitable public health service to. and just capturing the voices from there. So it was birthed from there. In terms of kind of the data collection and in terms of staffing, it's very much anecdotal information at the minute that we don't feel as a service that we're kind of capturing and delivering the Healthy Child programme on a health education basis. Rather, we're stuck in very much a way of that reactive service delivery in terms of the one-to-one work. We're not able to go in and do kind of as many assemblies as we can. And granted, if we do assemblies in school, we're then not capturing that same offer to those that are electively home educated or in children in care. So it's very much a concept at the moment, and I would be honest that there isn't that kind of solid data there at the minute, other than kind of the voices of young people and what's happening nationally, especially with SAFNA on board as well. In terms of it kind of fitting in with the ecosystem and everything in terms of care delivery, it would be kind of one of them things that will be adopted in terms of the universal offer that we would offer in terms of a school nursing service. And again, kind of relating back to that pilot offer, that we could trial it in Derbyshire, trial it within a certain area, and then aim to roll it out in different areas.
Thanks, Deb. And then that question about, so who are you going to work with to move beyond this brilliant idea into getting to a pilot and proof of concept? What do you need? You said you need support.
Yeah, so that support would kind of look like forming a specialist interest group in terms of kind of a digital focus, as that's kind of one area that we have got missing within our trust bases at the moment, especially for our children and young people. So it will be getting other staff members on board that are specialist community public health nurses, involving the health visiting team, as they have got some digital concepts going on already, and looking wider, more nationally. So looking at our SAFNA, so the School and Public Health Nurses Association, so that special interest, collaborating with other services, and whether there are any app developments out there that are similar in terms of kind of what we're trying to do, but bring everything together so the young people can have something that's accessible to them.
Thank you ever so much. I'm going to hand over to Helen to see if she's got any questions.
I do indeed. I'm going to stick with one in the interest of time, but I'm just wondering how you're going to involve the young people in terms of building content and making sure it stays live and real for their needs.
Yeah, so it would be very, very open in terms of capturing our target age range in terms of the 11 to 19 range, but it would be getting groups of young people that are obviously going through consent and ethics boards, making sure that they've got involvement in there, capturing their voice in regular forums, making sure that they're planned, making sure that people have the opportunity. So we have got many young people that do want to help innovate. For example, when we did do the poster delivery, there was about 30 young people that were more than happy to get involved. And we've got really good relationships with schools and within our communities. So yeah, it's putting it out there, and there'll be many people that would want to engage with it.
Fabulous, thank you.
Great, thank you, judges, and thanks, Nav. And now on to our final finalist in the Digital Practice of the Future category, who is Mohammed Shamir Muruddin from Doncaster and Bassett Law.
Hello everyone, my name is Mohammed Shamir Muruddin. I'm one of the lead practitioners working in Doncaster and Bassett Law, teaching NHS Trust. Today, I'm so excited to share with you an innovative concept that has the potential to transform the way we approach surgical preparation and education in an intraoperative environment. The topic I propose is AI-enabled surgical preparation education, empowering our theatre practitioner for optimal patient care. So AI is great at understanding lots of data and finding important patterns to help us make better decision-making process. Yes, it has huge potential to transform many aspects of patient care. Number of research studies is already suggesting that AI can perform as well as or better than humans at many tasks. So we all heard about this. So today algorithms are already outperforming radiologists at spotting different malignant tumors. So I would like to bring those kind of technology in an intraoperative environment to support our theatre practitioner work smoother and a better patient care and enhance the overall surgical experience. The content I would like to cover is problem statement, project concept, goals and objectives, empowering theatre practitioner with the AI, values of the solution to various stakeholders, project plan, next step, and conclusion. So let's start with the problem statement. So newly qualified nurses and ODPs entering into the operating rooms after qualification, it's really a challenging transition for them. So they have to adapt to new workplaces, fit into existing teams, and take full responsibility for their clinical practices. In addition to that, there are so many challenges they would face inside the theater, churches, understanding the different surgical procedures, adapting to the surgeon preferences, handling specialized equipments, time management, effective communication and teamwork, learning scrub technique, managing stress and emotions, continuous learning and building confidence. So these multifactorial challenges make it really tough for them to start their career successfully and grow professionally in theater. The concept of my project. So the challenges we are addressing is making our surgical preparation more efficient. So basically our AI system looks at data, predicts what surgeon prefers, and creates a customized list of instruments which helps saves time. Additionally, it's like a mentor for theater practitioner by using content management system, providing them with a detailed knowledge about procedures, instruments, use of particular consumables, and best practices. Moreover, it gives real-time guidance that adheres to trust policy. Yes, it is feasible. So it's going to be a real helpful for our theater practitioner. Let's talk about the objectives and goals of my project. So let's start with objectives. Enhancing the surgical preparation efficiency, empower theater practitioner with advanced knowledge, elevate patient safety and care quality, enable continuous learning. So these objectives are essential steps towards achieving my broader goals. Let's discuss about the goal of this project. Enhancing the theater staff confidence and the patient satisfaction. Optimizing the efficiency and resource utilization, foster scalability and wider adaptation, ensuring the ongoing improvement. These are my high-level vision of my projects. Through this kind of innovation, theater practitioner can focus more on patient care, communication, and teamwork, and thereby enhancing the patient safety, optimizing the outcomes, and reducing the stress levels. So value of the solution to various stakeholders. So far, we have discussed the benefits of this concept for the theater practitioner and patients through the goals and objective. Let's discuss how it's going to benefit the organization. So through this innovation, healthcare organizations will experience greater operational efficiency, better resource management, and enhanced patient satisfactions. So I would like to emphasize that it can be implemented across different healthcare settings, including the hospital, clinics, and community facilities, offering a scalable solutions that benefits the broader healthcare community. I'd like to talk about the project plan. Let's start with the project initiations. So project initiation, our starting point. We define our goals, gather our team, get approvals, set our timelines and budgets. When it is done, it followed by data collection and preparation. So where our groundwork begins. So we collaborate with the surgeons, lead practitioner, and other members of the staff and gather extensive data on surgeries and preferences. So privacy is our paramount. So and we clean and organize the data, readying it for the AI training. AI model development. We carefully choose the best machine learning tools and algorithms. We train our AI model using the data we have prepared. We fine tune the model to make it even smarter, conduct the rigorous training to ensure it's spot on. So AI integration. Seamlessly integrating our AI model into a surgical preparation is very essential. We ensure compatibility with the existing hospital system if possible and provide comprehensive training to theater practitioners, healthcare assistants, and other members of the staff for effective utilization. Education component development and protocol guidance implementation. It's very essential things in our project. So we create an education part in our AI system as a part of the content management system, providing critical information on surgeries, equipments, protocols, and step-by-step guidance. Keep it updated with the latest medical practices. Monitoring and evaluation. We use key performance indicators to measure the AI system effectiveness, monitoring it in real time. So getting feedback from our staff for the improvement and addressing any issues promptly. Continuous improvement and scaling. So we continuously analyze the data and feedback to make improvements. Our goal is to expand its reach and impact through the partnership and collaborations with other healthcare settings. Project closure and knowledge transfer. We rigorously evaluate the project success against our objectives and seamlessly transfer our knowledge to other healthcare teams and ensuring ongoing maintenance and sustainability. Post-implementation support. We offer continuous support and training to theatre staff and other members of the team. So we monitor the AI system performance, promptly address any issues. My next step is adding theatre procurement. So these strategic additions will provide us insight into overall theatre budget consumption, resource allocation, supply chain efficiency. So understanding this aspect will enable us to optimize resource management, reduce waste, and enhance the overall performance of the operating room. I would like to conclude by saying this AI-enabled surgical preparation and education concept really transform the operating room efficiency and patient safety, offering the tailored guidelines and education to theatre practitioner. I can assure you that it can make a big difference in various healthcare settings. Finally, through my strong leadership and effective collaboration, my idea sets a new standard for best practices in an intraoperative environment. So there are so many recent studies underscores AI potential in healthcare with improved diagnostic, cost savings, enhanced patient experiences. Thank you for listening to me.
Great, thank you. And for the final time in this category, it's time for the judges. Let's start with Natasha this time.
Thank you, Steve. And Mohammed, thank you for a fascinating presentation. I just have a question really about your research. So who have you involved to identify the problem and its a solution? And then further on from that, in terms of your research, why did you conclude AI and what other technologies did you consider?
Okay, so I just come up with the second question first, actually. So why AI? So AI, it's really great at understanding the data, what we have collected already. So, and it's really better in decision-making process. So I always wanted this kind of project. I mean, when I started my career. So definitely this kind of platform, it's really going to benefit to the future theatre practitioner to give some additional support for the theatre preparations. Obviously, it makes some confidence to theatre practitioner. It obviously will experience a smoother patient surgical journey. I have involved because as a theatre nurse, so I've been mentoring so many newly qualified nurses and ODPs, so I can see the challenges what they're facing. So those challenges I just mentioned in my presentations, like understanding the different surgical procedures, some time management skills, so adapting to the surgeon preferences. If you just, so I just discussed with my team members of my theater. So I just discussed with them. So okay, this kind of technology really going to benefit. So obviously enhancing the patient, theatre practitioner confident.
Thank you ever so much. I bet you Gemma and Helen are full of questions as well. So why don't one of you ladies chip in next?
Thank you, Mohammed. Really interesting. And really quite creative and innovative there. You set out a really comprehensive project plan in there. What do you think is going to be the most difficult element of that, and how are you going to work with wider stakeholders to address that?
Yes, obviously, I need just a project concept. Actually, I just brought with the project concept. I definitely need a team to implement. Obviously, I need a multidisciplinary teams like theatre education, because I'm using the education system. I just want to add some education system at the part of the content management. So I definitely need some AI experts, softwares to develop some algorithms. By using algorithms to bring what are the essential things needed for the surgery. Some admin, some managers, so many people's involvements needed for this thing.
And is there any particular element that you think is going to be complex or easy to get through? How are you thinking you're going to
complex? I would say so. Complex, I would say, is creating algorithm, because I never spoke to my friend actually who is a software field. So they told that it's not a big deal to create an algorithm, but I don't know actually how in terms of, for example, we need a data. So I'm so happy with the data, because for every surgery, what we are doing at the moment,
So we just got the surgeon's booklet actually. So we just note on the list what are the things needed for the surgery. We all got that book. So I'm going to use those kind of books to gather some data. So it won't be a challenging for us, but the complex thing is creating an algorithm. So definitely I need AI experts. Then obviously, so just need to regularly update some education content. For example, if you're using so many things such as sutures, there are different kinds of sutures we are using. So just want to update with what is the particular use of the sutures. So just provide some education, overall education. So what are the different types of sutures? Why this suture is using for this particular surgery? Just want to empower with knowledge. So definitely it can make some changes on the patient care as well.
Great, thank you very much. I'll pass you over to Gemma.
Helen, and thank you, Mohammed. I was just wondering about your vision for the transferability of this as a solution. So do you see this as something that could be used in other settings so the learning can be spread?
Yeah, definitely. So it can be scalable in so many, because even clinics, they are doing the small kind of surgery, small procedures. Obviously, it can be scalable in so many areas. In the community setup, if it is a private hospitals, NHS hospitals, yeah, it is scalable. Actually, it is feasible as well. This is a project actually I always dreamt of. Okay, when I started my practitioner journey, so I just wanted to use this kind of platform to support my colleague.
Wonderful, thank you.
Great, thanks everyone. So we're out of time. Thank you very much to our first set of finalists.